Hi everyone, welcome to my channel Capsa. In this tutorial, we will understand about rheumatoid arthritis. So first look at the definition. Rheumatoid arthritis or RA is a chronic inflammatory autoimmune disease that mostly affect your joints, and it can affect multiple body systems like heart, lungs, nerves, eyes, skin, etc. According to studies, women are more affected than men with a ratio of 2:1 to 3:1, and prevalence rate in case of women increases up to 5% after 55 years of age. European, American and Australian pupils are more affected, okay, because their genetic combinations. Now, rheumatoid, it means it's a Latin word. It's a Latin word which means troubled with rheum. Now, rheum is a Greek word which means flow, and arthritis also a Greek word which means disease of joint. Okay, that is rheumatoid arthritis. Why it is denoted as chronic? Because long lasting. Inflammatory means obviously pain and swelling will occur in your joints. You should keep in mind that pain is mainly due to prostaglandin, release of prostaglandin, and the progressive damage of joints is responsible for due to cytokines. Okay, autoimmune means patient's own immune system or antibodies mistakenly attack the healthy tissue, which leads to deformity of the joints. Okay, now we will understand which kind of joints are mainly affected. Okay, so mostly proximal interphalangeal joints and metacarpophalangeal joints of the hands, wrists, small joints of the feet including metatarsophalangeal joints mainly affected. But distal interphalangeal joints are generally not affected. We will understand this with a picture. Okay, so this part or DIP or distal metaphalangeal, this part is not affected, mainly not affected in rheumatoid arthritis. Only PIP, MCP and MTP are affected. PIP means proximal interphalangeal joint, MCP means metacarpophalangeal joints, MTP means metatarsophalangeal joints. Okay, so MTP, PIP, MCP mainly affected. Clear? Now, RA actually or rheumatoid arthritis actually follow a pattern. Means how many joints will affect, when they will affect, this type of. Okay, so for this RA actually follow two patterns. First one is Polyarticular pattern, means 5 or more joints will involve and the patient will experience an explosive polyarticular onset which will occur over 24 to 48 hours. Okay, second pattern follow, that is palindromic pattern. Okay, palindromic pattern. In this pattern, patient feels pain and swelling in one or two joints that may last for few days to weeks, then completely go away. Later again return the same joint, in the same joint or other joints are affected, and this time with so much increasing amount of pain. Okay, this type of two pattern actually follows by RA in case of RA. Now, what are the risk factors? Actually, there are, as because rheumatoid arthritis is a multifactorial disease, So there are so much factors involved in rheumatoid arthritis. It means the main cause is not known till now, but there are some factors which can exacerbate the rheumatoid arthritis disease. Here risk factor means who are more likely to develop RA. So the first one is age, means women with 55 years of age are mainly affected, and according to the studies, children and younger teenagers also affected, and the disease is called as juvenile idiopathic arthritis. Okay. Second one is family history and genetics. So if one of the family member has rheumatoid arthritis, you may be or the patient may be more likely to develop the disease. And genetic means a specific gene linked with RA or rheumatoid arthritis, and this gene actually response activate with the response of immune system, means this kind of gene linked with the immune system. Okay, and the name of the gene is HLA-DR4, and I have told that European, Australian and North American pupils are more affected because 60 to 70% of this kind of people have this gene, and among them European ancestry people carry this gene much more. Okay. Third one is sex hormone. Obviously women are affected means due to the effects of estrogen hormone. Fourth one is obesity. It means excessive fat tissue will release more cytokines which can causes the inflammation of the joints. Fifth one is lifestyle. If you smoke, it means smoking changes in a sleep habit and also stress, this kind of. Sixth one is vitamin deficiency. It was studied that vitamin D and E deficiency can increase the risk of rheumatoid arthritis. And the last one is environmental exposure, means amount of exposure to the chemical, some amount of exposure in chemicals can causes rheumatoid arthritis, and this kind of chemical is named as PAH or polyaromatic hydrocarbons. If there is more amount of exposure to this chemical, there will be more tendency to increase the risk of rheumatoid arthritis. Some kind of food also affect the risk of rheumatoid arthritis. This kind of food are processed meat, red meat, which can worsen the actually symptoms of RA. Okay. Now we will understand how the rheumatoid arthritis actually develop. So in this picture you can see this is bone, this is synovial membrane, this is articular cartilage, this is synovial fluid, fibrous joint, blood vessels, and this is Pannus formation. Now what is Pannus? Pannus is nothing just an abnormal tissue growth with angiogenesis. Now what is angiogenesis? Angiogenesis means new blood vessels formations. Okay, the process of new blood vessel formation is known as angiogenesis. Now Pannus is mainly due to excessive proliferation of synovial tissue. Now synovial fluid obviously secretes from synovial tissues. So if there is excessive proliferation of synovial tissue, obviously there will be increased volume of synovial fluid, which will leads to swelling of the joints. We will understand this step by step. So normally immune system makes antibody that will attack the bacteria and tissues and helping to fight against infection. If you have RA, your immune system mistakenly send the signal to antibodies to attack your joint tissue or synovial tissues. Okay, and it causes sore or inflammation or swelling of the synovial tissue. which releases chemicals, obviously, like cytokines, and that will damage the nearby bones, cartilage, tendons, ligaments. So what I have said, that antibodies will mistakenly attack the synovial tissue or synovium, which will develop early synovitis. And this early synovitis will slowly develop into early RA, okay, which will leads to joint destruction. Okay, so this is the cause and pathophysiology. Now we will understand what happens in early synovitis. So in early synovitis, what happens in this phase? Actually, first B cells and T cells gets activated. Second, macrophages activation will occur. Third one is endothelial cells will activate. In the second stage or early rheumatoid arthritis, what happens in this stage? This activated B cells and T cells will initiate hyperimmune response in the blood. So it will initiate hyperimmune response in blood, and activated macrophages will initiate and recruitment the pre-inflammatory cytokines, which will then activate tumor necrosis factor alpha, interleukin 1 beta, and interleukin necrosis factor KB. This kind of factors will activated by the activation of macrophages. And endothelial cells will activate or increase the expression of adhesion molecules, which will leads to accumulation of inflammatory cells. So accumulation of inflammatory cells. Okay, then what will happen during the joint destruction? Simply Pannus formation will occur. What is Pannus? This formation will occur. Okay, so this is the end of my lecture. In the next part or second part, we will understand about or discuss about symptoms, what are the diagnosis, test, and what are the treatments of rheumatoid arthritis. Okay, thank you.